Okay, Mrs. Bumi. Okay. Good evening. I'm very happy. If you can tell, I'm very happy. Okay. We thank God for good health. We thank God for life. Mm, that we're able to meet again. We thank God. Okay. So today we're going to discuss ulcer. All right. How you can effectively heal an ulcer. This is one of the most, should I say, requested sessions, because quite a number of people with hypertension I've realized are also ulceratic. Okay. So I want to break it down for us today. Let's discuss the differences. What is ulcer? What's not ulcer? How do you know you have an ulcer? What exactly is ulcer? What caused your ulcer? Okay. Because many times you go to the clinic and they tell you that they don't know the cause of your ulcer, right? So let's talk about it today. Okay. All right. So before I begin, I just want to put out a security notice. Okay. I would never call you to inform you about my sessions. Okay. My Zoom sessions, I would never call you personally to inform you about any of my sessions. I will put all of the information I need you to know on the group. And I have your email address as well. So some of you receive emails from me. Okay. You all receive emails from me. If you open them, if you check, you would see. That's the only way that I would communicate with you. I don't need to call you. Okay, that means I'll have to call everybody to inform them about my sessions, and I can't do that. Okay, because people are on the groups with ulterior motives. Okay, they will call you saying that I'm hosting a session, and then they would send you a code. Please don't read out any codes to anyone, and kindly turn on your WhatsApp verification. Okay, please turn it on, because if you turn it on, then when someone wants to hack into your WhatsApp accounts, WhatsApp would notify you. Okay, are you aware of this? And if you're not aware, you can decline and they will deny that person access. Because once they gain access to your account, then they begin to message people on your contact list asking them for money, and they can defraud many of your friends and families. Okay, so please, I would never call you to inform you about my sessions, anything I need you to know, okay? Except if we are discussing on a personal level, I would put it on the group, okay? For everyone to know, for everyone to be aware. I don't need to call you personally to inform you. And I am not working with anyone. If I was working with someone, I would have introduced that person to you from the very beginning. Okay, I don't have an assistant. I'm working alone. Everything I do with you, I do it on my own. Okay, so please, let's just be careful. Okay, all right, all right. So let's begin. What is and is not an ulcer? Before we begin, we have to know some basic terms, I would say. The first thing I want you to know is what we call gastric acid. Okay, so gastric acid is a combination of HCl, KCl, sodium chloride as well. So you have potassium chloride, sodium chloride, hydrogen chloride as well. Okay, hydrochloric acid. Okay, so that's what combines to make gastric acid. Okay, now this is very important. Gastric acid helps with a lot of things, including breaking down your food, including killing bacteria. Okay, so it's a necessity in your stomach. All right, and your stomach produces 0.5 to 1.5 liters of this gastric acid every single day. All right, and the pH of this is 1.5 to 3. Okay, so it's very, very acidic. All right, now the work of gastric acid is to break down your food. Every time you eat, gastric acid works to break it down and to kill any bacteria that may have found its way there. Okay, so I want you to take note of this kill bacteria, because we are going to need it, okay, later on. All right, now in your stomach you have what we call a mucus layer. Now that mucus layer is what protects your stomach itself from getting hurt by this gastric acid, because gastric acid is quite acidic. okay? So in order to prevent your stomach itself from getting injured, you have this mucus layer to protect it, okay? Another thing I want you to note is what we call lower esophageal sphincter, okay? This sphincter is what keeps food and gastric acid inside the stomach, okay? So I have a simple diagram here for you, just so that we can be clear, okay? So this is your stomach, okay? This sad-looking stomach here. And as you can see, this sad-looking stomach has an opening here, all right? And if we expand this opening, this is what we have. You can see that this is the mucus layer of the stomach, okay? Underneath, you then have various layers like the epithelial layer, which we are not going to go into, okay? But our main focus today is this mucus layer, all right? So this is what I want you to take note of. This rough looking part of your stomach, that's the mucus layer, okay? And over here, you would have your lower esophageal sphincter. This is what will keep your gastric acid and would also keep food inside your stomach to prevent it from, going back up, okay, into your esophagus. All right. Okay, so this is just a magnified view. This is what I want you to take note of. Okay, so based on this, ulcer is a damage to this mucus layer. Okay, when this mucus layer is affected, that's what you call an ulcer. When you have a hole in that mucus layer, if it is damaged, if you have a wound, an opening, okay, that's what you call an ulcer. All right. Now, acid reflux or GERD, okay, that is when this lower esophageal sphincter is open and gastric acid and your food can go back up into your esophagus, okay? So that's what happens when we say somebody has an acid reflux, because this sphincter is meant to be closed. That's the work of the sphincter, to make sure that your gastric acid and your food remains in your stomach. So if for any reason it opens up, then gastric acid can splash into your esophagus. It can go up, okay? And it can cause a lot of discomfort, all right? So what is going to cause this splash? Our topic today is not acid reflux. We're going to talk about it at a different time. But what is going to cause the splash is basically an alkaline environment, okay? So remember I said that your stomach is quite acidic, okay, because of gastric acid, okay? If for any reason your stomach loses that acidic nature and it turns alkaline, that splash can happen, okay? And that's when you would feel a sort of heartburn, okay? And what would cause this splash is basically your refined foods, okay? That would shift the acidic environment of your stomach to alkaline, okay? All right, so that's the difference between an ulcer and an acid reflux. So we're not talking about this splash. What we are going to focus on today is this wound, this injury, okay, in our stomach. How did it get there? Okay, what exactly caused your ulcer? Because you were normal before, nobody was born with, nobody was born with ulcer, okay? You developed it, okay? So what exactly is the cause? Why is it that when you go to the clinic, they tell you have ulcer, but they're not able to tell you what is the exact cause of your ulcer, okay? Yes, we know a few things like H. pylori bacteria. We know a few things like your food, okay? But ulcer itself is quite a harmful thing. And the first thing I want you to know is if you ate well, if your diet was healthy, you wouldn't develop ulcer, okay? That's one of the first things. One of the first causes of ulcer and the basic cause of ulcer, okay, is not even your H. pylori bacteria, all right? It's poor dieting patterns, majorly refined foods, okay? So this opening in your stomach lining, in the protective layer, you can imagine that what is supposed to protect your stomach from this harmful acid is being damaged. It has an opening already, okay? So you can imagine that protective layer is no longer there. It's just like the sun and the ozone layer. Imagine if we don't have the ozone layer anymore. That is, we are just being scorched by the sun. We think it's hot right now, but if we don't have that ozone layer, things could get really, really bad and dangerous. So that's the way it is with your stomach as well. That protective layer, okay, there is an opening there. So that acid is touching the part that is not supposed to touch. You can imagine that you are experiencing, it's just like somebody throwing acid on your skin. Okay, you can imagine how harmful that can be. All right, so that mucus protective layer is no longer there. Okay, and the reason is majorly because of oxidative damage. Oxidative damage. What is this oxidative damage? As a human being, as you are getting up every day, you go to work, you eat your food, you exercise, you sleep, you pass urine, you defecate, you are just living your life, you are breathing, you are walking. So many chemical reactions are going on to make sure that you are able to do those things as a human being, okay? Now, when you eat certain foods, especially foods that you are not supposed to eat, like refined foods, like processed foods, okay? Foods that are high in cholesterol, excess fried foods, high carbohydrate foods. When you eat such foods and you get very little antioxidants, the word is antioxidants, anti-oxidation, something that's supposed to be against oxidation. When you don't eat well and you lack these antioxidants, you are open to danger, especially when you don't eat well and then you go out into the outside world and you are exposed to environmental pollutants. You are under high stress, okay? You take in all manner of sodas, you are just exposed and you don't have any sort of protection. This protection now is what we call these antioxidants. You are open to danger, okay? That's one of the primary reasons you are battling with ulcer, because you have consumed, up until when you were diagnosed with ulcer, very little antioxidants to help protect you from the outside world and even from your diet, from yourself, okay? You have consumed very poorly. Now, one of the antioxidants that is very, very crucial when it comes to your digestive tract and when it comes to your stomach is what we call vitamin E, okay? There are so many different types of antioxidants. We have astaxanthin, we have beta carotene, we have vitamin C even, is an antioxidant, okay? But you see, vitamin E, it's very crucial to your stomach health, to your gastric health, okay? It's one of the antioxidants that help protect your stomach lining, okay? And that also helps to protect the arteries of your stomach as well, because your blood moves everywhere. Your blood, transportation of blood, transportation of nutrients happens all the time to all parts of your body, okay? No matter how tiny it is, okay? So you can see, if you don't have this vitamin E to protect your stomach against oxidative stress, against the harmful effects of refined foods, you best believe that you are going to be affected. And that's why many of you are ulceratic today, because you have lacked that vitamin E, okay? That's supposed to help protect you, okay? To help protect your arteries of your stomach, make sure that they are okay, all right? So vitamin E, one of the most important things, okay? Now, speaking of antioxidants, what I have for you in your wellness pack is astaxanthin, which is 14 times stronger than this vitamin E, okay? That would help you fight against this oxidative stress, okay? Because it's one of the causes of many diseases that we battle with today, okay? So this astaxanthin is one of the top antioxidants that beats all other antioxidants, because not all of them have the same efficacy. Some are stronger than others, okay? And you have astaxanthin here to help you. Now, another reason why you are ulceratic is because you have lacked certain vitamins because of how you eat, okay? Now, there are specific vitamins and minerals that you lack as an ulceratic patient. We have vitamin B1, we have B2, we have B6, we have B12, you have vitamin C, and you have folic acid. These vitamins are very crucial when it comes to your gastric health, okay? And you will be ulceratic if you are deficient in one or more of these vitamins and nutrients, okay, or minerals, okay? You would be ulceratic. So over an extended period of time, if you have been consuming a lot of refined carbs, if you have been consuming a lot of carbohydrate foods, a lot of processed foods, a lot of trans fat foods, high cholesterol foods, and you are lacking in these vitamins and minerals, you best believe that you're going to develop ulcer, coupled with the fact that you are lacking also in antioxidants, okay? So these vitamins and minerals are essential to your gastric health, okay? And what I have for you to help you to prevent this type of thing from happening, in your wellness pack, you have this multivitamin there, okay? Now that multivitamin supplies you with your daily dose of your vitamin B1, B2, B6, B12, your vitamin C, your folic acid, okay, in their right amounts. Now, the good thing is this year, we have introduced a separation of the contents of the wellness pack, okay? And it's even, I think, better because now you can choose, okay, I want to go for this particular one. I want to go for astaxanthin only. And now you have it in such a way that you now have a 2-month supply of your multivitamin and you have a 1-month supply of your astaxanthin. Okay, so it's no longer the 21-day, you know, as opposed to your wellness pack that you are familiar with. Okay, so I think that this is really helpful if some of you just want to go for that multivitamin or you just want to focus on your antioxidant level. Okay, it would really help. Okay, and it also helps with affordability as well. Okay, so this is the major reason, the first reason, not even your H. pylori bacteria, but the first reason many people have ulcer today is because of poor dieting patterns. And these are the things to look out for when it comes to these patterns, okay? Your B1, B2, B6, B12, vitamin C, and your folic acid, okay? And when it comes to your antioxidants, you have your vitamin E that is essential for your gastric health, okay? All right, now let's move on to the other causes of ulcer. You have your anti-inflammatory drugs that many of you abuse today, okay? Now, when you take these anti-inflammatory drugs, it has an irritable effect on that mucus layer of your stomach, okay? And it impairs that barrier. It weakens the barrier. And it also reduces blood flow, okay? And if your stomach itself is not getting blood flow, that means that it's getting very little nutrients, which means that the health of your stomach is being affected, okay? So some of these anti-inflammatory drugs you may know are aspirin, ibuprofen, naproxen, just to mention a few. Drugs that when you have a little problem, you just take. Another one is Panadol, okay? All these things have effects, okay, on your stomach lining, okay? And what it does is it can decrease blood flow to that mucus layer. It can impair that mucus layer, and it can also irritate that mucus layer as well. That's one of the things that will cause that tear, okay, in that mucus layer, in that protective layer of your stomach. These are one of the things that will cause that opening to be there, okay? Another thing is your alcohol and high stress, okay? I don't need to tell you the dangers of alcohol. You know the dangers of alcohol. And when you are highly stressed out, instead of your body to focus on digestion, okay, your body is focusing on your external environment, trying to make sure, why are you so stressed out? Is there danger approaching? You are in a fight or flight mode. You are not in a rest and digest mode, okay? It's just like you walk into a room and you see a lion. You are not at ease in that room. That's the same way your body operates when you are under stress. It's like your body is aware that there may be danger coming. So your body just focuses all its attention on your external environment, okay? So high alcohol consumption and chronic stress can cause ulcer, okay? Believe it or not, okay? It can cause ulcer. Another cause of ulcer is what we call hypercalcemia, okay? Excess calcium in the blood, okay? Now, this is a sort of disorder where your parathyroid gland is producing more than it's supposed to, okay? So many of you may not suffer from hypercalcemia, but for those of you who are aware that you have excess calcium in your blood, it can cause you to have ulcer. The reason is if you have a very high calcium roaming about your bloodstream, it can increase gastric secretion. So remember I mentioned at the beginning of the session that your body produces 0.5 to 1.5 liters of gastric acid. If you have excess calcium in your blood, your body can produce more gastric acid, which will then be harmful to you, okay? So that's actually the correlation between ulcer and high blood pressure, okay? When you are ulceratic and you also have hypertension, the correlation between it is this hypercalcemia, okay? The odds are you may have excess calcium in your blood. That is what is causing your BP to go high, okay? Not all of you anyway. A simple blood test would tell you if you have excess calcium in your blood, okay? A simple blood test would inform you of that, okay? So just to let you know, this is one of the reasons you may, you may develop ulcer because of hypercalcemia, all right? Okay. Now we have the one that many of us are aware of, our H. pylori bacteria, okay? Okay, so I mentioned that your gastric acid puts your stomach environment within a pH level of 1.5 to 3, okay? If for any reason that mark of 3 is exceeded, that is the pH level of your stomach begins to rise to alkaline levels, 4, 5, 6, 7, 8, okay? What would happen is that because the environment is no longer acidic, okay, it is now alkaline. It breeds pathogens, it breeds bacteria. An example of such bacteria is your H. pylori bacteria, okay? Now, when H. pylori comes in, because your stomach environment is no longer acidic, when it comes in, what it's going to do is going to start biting and eating away that mucus layer, okay? So let's go back to our diagram. Let's go back to our photo. You see this funny looking bacteria here that looks like it can poke you, right? When it comes in contact with your stomach lining, because you have lost the acidic nature of your stomach, what is going to happen is it would start to bite off this mucus layer, okay? It will start to eat it up, and open it, okay? Then your gastric acid can then affect the inner linings of your stomach, which it is not supposed to come in contact with, okay? So this is simply what we refer to as H. pylori bacteria, all right? So the absence of this mucus layer would expose your inner lining and would cause you pain, okay? So what causes you to have H. pylori bacteria is because you have lost that acidic nature of your stomach, okay? You have lost it, all right? Now, when it comes to your medications, your ulcer medications, we have this common misconception that if you are ulceratic, then it means that you have too much gastric acid, or it means that your stomach is too acidic, which is not the case, because your gastric acid keeps your stomach below pH 3, okay? What could be more acidic than 1? What could be more acidic than 1? Okay, so the problem really is not that you have excess gastric acid, that is, except you are suffering from hypercalcemia. Okay, you can find out if you have hypercalcemia by taking a blood test. Okay, if you are not suffering from hypercalcemia, the reason you are ulceratic is not because of too much gastric acid. Neither is it because of the intensity or how extreme your gastric acid is, because it can't get extreme. It can't get more extreme than one, okay? It can be more acidic. It's already highly acidic, okay? So ulcer is actually the lack of acid. The lack of acid that would cause these microbes, this bacteria, like H. pylori, to then start growing and taking effects. I don't know if you understand what I'm trying to say. Do you understand me? Kindly let me know in the chat. It is the lack of acid that would cause these bacteria, like H. pylori and the rest of them, to begin to grow and take effects, okay? And one of the things that will cause you to lose your acidity, the acidity of your gastric acid, one of the things that will cause you to lose that is the way you eat food, is the way you consume anti-inflammatory medications, how much stress you are under, okay? How much alcohol you consume, okay? So those are the things that will then cause you to lose the acidity of your gastric acid, and we will then cause H. pylori to then, start growing in there, okay? And then H. pylori itself will then cause further damage, okay? Will then eat up that protective layer of your stomach and, give you a proper wound, okay? Then because your stomach, as it is digesting food and as you are making use of your gastric acid, remember I mentioned that the point of this gastric acid is to kill bacteria, okay? If you were here from the very beginning, I mentioned it, but let me just go back. One of the functions of this gastric acid, okay, is to kill this bacteria. So if for any reason you lose your acidity, it means that bacteria can then grow and take effect and breed and even give birth and multiply, okay, in your stomach, causing you pain, causing you ulcer, okay? So this is the reason why. It's not really because of too much acid, okay? So that's a misconception that we have that we need to we need to debunk, okay? But treatment makes it seem like you have too much acid, because if you have an opening, let's reason it, okay? You have an opening that was caused by lack of acid. Now, yes, it's your environment is now alkaline, okay? But because you have a little acid within that alkaline environment, because you now have an opening, it hurts you, right? It's painful. Now, because it is painful, we see it as, oh, it is the acid that is causing that pain. Meanwhile, the acid is not to blame. I don't know if you are getting me, okay? If you had proper acid there, your mucus layer wouldn't have been destroyed. Now that it has been destroyed and your stomach produces gastric acid every single day, every time that you eat, your stomach produces gastric acid for digestion purposes, okay? And when that acid comes in contact with that wound in your stomach, it hurts you. Then you go to the clinic and it now seems like, oh, it is the acid that is causing you the pain. Meanwhile, the acid is not to blame, because the acid has to be there, except you don't want to digest food anymore, except you don't want to digest food, okay? Except you want to bypass your digestion, okay? Which, that's not a good thing, okay? So our treatment makes it seem like it is the acid that is the problem, okay? And your medications, what they would do is now reduce the amount of acid that is being produced, okay? If you research, how do my ulcer medications work? One of the first things you're going to see is that it reduces the amount of gastric acid that is being produced, okay? And if it reduces the amount of gastric acid, that means your pain is going to reduce as well, right? And of course, you have side effects of these medications, okay? Like gas, vomiting, headaches, kidney inflammation, dementia, bone fracture, you name it, okay? You are experiencing it, okay? So this is how your medications work. So it's actually, everything is kind of flipped. Okay, everything is kind of upside down. Okay, we are misunderstanding it. Okay, and that's why it's quite difficult for us to treat it. Okay, all right. So please let me know. Are we following? Are we together? Are we together? I will take questions, please, but I just want to make sure that you are understanding me. Okay, please let me know. Do we understand what I'm trying to explain? Is it clear? Okay. All right. All right. So let's discuss some remedies. Okay. Let's discuss some remedies. So the first remedy is, of course, your intermittent fasting and your healthy eating habits. Okay. The less time your body has to digest food, the less you would experience that acid production. Okay. So if you can give your body only 2 times to digest food in a day, then the less you would feel your pain, if you understand what I'm trying to say. Okay, because it's when that acid is produced, it comes in contact with that wound, and then it hurts you. Okay, so the more you can fast, the better for you. Okay, and then you have your healthy eating habits, which is the problem, the basic reason you are ulceratic. Okay, so we have less refined carbs. Try as much as possible to consume less of things like your noodles, your Indomie, your cake, your bread, your potato fries, your white rice, your cereal, your added sugar, things like pizza, things like cookies, refined foods, processed foods like hot dogs, corned beef, all these canned foods, okay? Also, that vegetable oil that you are using, okay, is adding to your problems, okay? I know we like to fry foods a lot in Nigeria, okay? And I've talked about this. It's part of your health issue, okay? It's a contributing factor to your health problems, okay? So the better you can eat, the better your health, okay? That's the basics of it, all right? Now, another thing that can really, really help you with your ulcer, a remedy, is your cabbage, okay? Now, cabbage has some ingredients, if I should call them that, okay? It has some compounds, okay, that would help you destroy H. pylori bacteria, okay? Your cabbage has good compounds in it that would help you kill and destroy H. pylori bacteria, okay? And the more you can get rid of your H. pylori bacteria, the better for you, okay? Because that means that you won't have any of those pesky bacteria eating away that mucus layer, okay? You won't need to, they won't eat it up any further, okay? At least let's heal the wounds we have now before we and not create more, okay? If you understand what I'm trying to say. So cabbage in itself has some good compounds that are capable of destroying this H. pylori bacteria. Now, cabbage juice actually is very, very good for ulceratic patients. Okay, they have, I researched and I saw that studies were done, okay, between our medications and cabbage juice. All right, so with medications, people who were on medications had 81% improvement, while those who were on cabbage juice, had 83% improvement. So it's a slight difference, but it's better for you, okay? Because that means that you would then bypass all the side effects that omeprazole would have had on your system, okay? Cabbage juice wouldn't give you all those side effects, okay? The same thing with cimetidine and cabbage juice. A study was conducted. Those who were on cimetidine had improvements over 28 days, while those who were on cabbage juice had improvements over 15 days, okay? So you can see that cabbage juice actually has some very, very good, is very, very capable of helping ulceratic patients, okay, when it comes to destroying that bacteria, so that you can focus on healing the wounds you already have and not create more as a result of the presence of H. pylori bacteria, okay? All right, now I have shared this with you in the past. For those of you who were attentive, I put together a vegetable juice. Okay, I put 10 free recipes for you in that ebook. Okay, and I gave it to you for free. And this is one of the recipes that was in that ebook. Okay, an anti-ulcer juice recipe. So please, if you overlooked it before, here it is again. Okay, please try it out and give me feedback. Let me know if it's helped you. Okay, I'm not saying that you should now throw away your ulcer medications, but this can be a good, it's a start. Okay, this is cabbage that you have everywhere in the market. Okay, so you get 1/4 cabbage, the head. Okay, you get 2 carrots, you scrub it, you peel it, remove the top, remove the bottom. Okay, and then you have your lemon, which is optional. Okay, so if you are ulceratic and you realize that lemon hurts you, then leave it out. Okay, if you can consume lemon, you can consume it. Okay, so know your body system. So all you have to do is simply juice these ingredients. Okay, or if you don't have a juicer, you can blend it. Okay, you can also consume your cabbage raw. So it's not a must that you that you make a juice out of it. Okay, but this is just one of those recipes to help you. Okay, please take it seriously. You can take this morning and night. Okay, at breakfast time and at dinner time as well. Okay, give yourself a month and see how it helps you. Okay, all right, so that's one of the recipes I have for you. And the last remedy I have for you is zinc kosine supplements. Okay, zinc kosine works very, very, very well for your gastric health, for your stomach lining. Okay, just as vitamin E is so important or was so important in the early stages of your life that would have prevented you from getting ulcer. Zinc kosine is now very, very crucial when it comes to healing ulcer. Okay, so your cabbage juice, your zinc kosine supplements, you're practicing intermittent fasting, as well as your healthy eating habits. Okay, these are the 4 key ways, 4 key remedies. Okay, aside your medications that would help you with your ulcer. Okay. All right, and with that, we have come to the end of this presentation. Okay, all right, so please ask me your questions now while I scroll up to see the ones that you have asked me already. Okay, okay. Yesterday says, I have lower back pain, so I take anti-inflammatory drugs. Well, you can't do without them, so do what you can do now. Okay, practice some of these remedies I've already given you. Okay, since those drugs are inescapable for you, do what you can when it comes to natural means. Okay, and see how far that gets you. Okay. So why are we giving omeprazole and antacids? Well, you see, medicine, the key, I don't know how to say it, but if you approach a doctor, the first aim is to get you out of pain. Okay, is to get you out of pain. If you then begin to think long term, then you would then think of lifestyle medicine. Okay, but your doctors now, the doctors that you see when you go for consultations, our first aim is to help you get out of pain. And one of the things that's causing you pain, yes, your acid is not the problem, but the damage has been done. Okay, and now because of the presence of that acid, it is causing you pain. So what are we going to do? Create medications that will help subdue the production of that gastric acid. Okay, so because of this session, okay, now you are aware of how your problem came to be. All right, now you are aware of what you need to do. Okay, do it. All right, do it now. Do these remedies I've given you. Start with your cabbage juice. If you can get your zinc kosine supplements, you get them as well to help you. Okay, that would help, and then you can reduce the amount of times you are taking your antacids and your omeprazole. Okay, so yes, your acid is not the problem, but the damage has been done, and we need to grant you relief. Okay. All right. So I hope that I have explained that. Does magnesium help to heal ulcer? It's not one of the key things. Okay. It's not one of the key things. If we are talking about the key minerals to helping you get rid of ulcer, the first thing is your zinc kosine. Okay. That's the first thing. Okay. Then you talk of your vitamin E, you talk of your B vitamins, your vitamin C, and your folic acid. Okay. What I have mentioned in the beginning. All right. Yes, the session is being recorded and I would grant you a replay. Okay. I would grant you a replay. Okay. Okay. I see all of your comments. You are welcome. Okay. Does yogurt help? No. No. Yogurt does not help you in any way when it comes to your ulcer. Okay. You're welcome. Use your coconut oil instead. Okay. Use your coconut oil as opposed to your granite oil. Okay. Use coconut oil, use olive oil. Those are healthier options. Okay. Your granite oil, your vegetable oil, those are seed oils and they cause a lot of inflammation. That's one of the reasons you have that back pain. Okay. That's one of the reasons we have back pain. That's inflammation. Okay. So please, that oil, it doesn't add anything. Yes, cholesterol free, trans free. Okay. The more you can abstain from it, the better for your health. I promise you. Okay. I know it's tough because you like fried foods, you like fried plantain, you want to fry yam, you know. And one of the ways that you can assist your health when it comes to these vegetable oils is trying your best not to reuse the same oil you used before. Okay. All right. Okay. Okay. Holland and Barrett, if I can see a photo, I think I would know. Reverend Ceci, if I can see a photo, I think I would know because these names, they are pretty faint to my memory. Okay, when I'm done, I would upload the replay to YouTube. Okay. Hello, can you hear me? Can you hear me? I was cut off for a while. Okay, I think I was responding to Reverend Ceci's question. The most important thing you should look out for is if they write zinc, L-kosine. Okay, that's the most important thing to look out for. Okay, zinc, then L, you will see a hyphen, then kosine. Okay, that's how you know that that's the supplement to get for your ulcer. Okay. All right. So when I'm done, I would upload this to YouTube as usual. Okay, and to my Facebook as well. So if you prefer YouTube, if you prefer Facebook, no problem. Okay. Mrs. Elizabeth says, there is this leaf they call miracle leaf. I learned if you take 2 leaves and eat together with groundnuts for 2 weeks, ulcer will go. Is it true? I'm not sure, ma. I do not know if it's true or not because I haven't tried it. Okay. But I would take it down. It's interesting. So if it works so well, how come we don't hear often about it? The miracle leaf. So I will have to do some research on that and you take it with groundnuts, okay? All right, no problem. I will look into that. But my research before I came in here, this is what I have for you on my slides right now, okay? The remedies I have for you right now are the ones that I found based on research, okay? All right, all right. Okay, any other question? Any other question? Okay, if there are no more questions, can you please give me feedback? How was the session today? Did you learn something? Was this beneficial to you? Please let me know, okay? It helps me. It helps me a lot. Your feedback helps me a lot, okay? So please let me know. How was our session today? Did you benefit something? Yes, I will, okay? I will. I will definitely do research on it, okay? Okay, all right. So I'm happy that you liked the session. Shall we call it a night? Shall we call it a night? Okay. All right. So take care, everyone. Please stay healthy. Take good care of yourself. I wish you the best of health. Okay? All right. I will see you next week by God's grace. Okay? Bye. Take care.